Imagine a scenario in which a doctor is caring for a patient and writes down a medication dosage for this patient. Let's take a closer look at what they wrote. How would you interpret this? The doctor had intended to write 8.0 milligrams, but based on the picture, if the decimal point had been missed by another healthcare practitioner, they might mistakenly give the patient an 80 milligram dose. This 10 times dosage increase could be extremely harmful to the patient.
This is one of the potentially harmful impacts of using dangerous abbreviations, symbols, and dose designations that are not approved by Accreditation Canada. To prevent these instances of miscommunication from occurring, healthcare institutions such as St. Joseph's Healthcare in London are reviewed every 3 years by Accreditation Canada to ensure that their forms meet the standard of care and do not use any abbreviations, symbols, or dose designations that are likely to be misinterpreted and could lead to harmful medication errors.
Our objective is to help St. Joseph's Healthcare London to review 1,200 forms used to document patient care to evaluate which forms meet the standard of care and which forms need to be revised. This will be done based on the list of abbreviations, symbols, and dose designations in clinical documentation endorsed by the Institute for Safe Medication Practices Canada, as stated in our Safe Use of Abbreviations corporate policy.
Last year, London Health Sciences Centre developed a successful system for tracking changes when reviewing their forms to ensure that they met the standards of Accreditation Canada. Similarly to LHSC, we will be using an Excel document that includes fields such as form number, where the form came from, whether there is an error, and if there are any errors, what the type of error is, and what correction needs to be made to reverse this error.
There are 1,200 forms to be assessed, and we will plan to split them equally between our 6 group members. Each group member will review their 200 forms to determine which forms meet the standards and which forms have errors and need revision. This will be summarized in the Excel document, which will then be returned to St. Joseph Healthcare London. In order to complete this project in a timely manner, each group member has committed contributing an average of 2 hours per week at St. Joseph's Hospital Health Information Management Unit. We have also set aside time for bi-weekly meetings to check in with our community partners and to make sure we are all on the same page when reviewing the forms.
Furthermore, every crew member has taken the time to make sure we have a comprehensive understanding of the types of errors we are looking for so that no errors are missed. Accreditation Canada helps health and social services provide consistent and safe care. By completing our project, we're committed to helping St. Joseph's Hospital standardize forms to increase their efficiency and improve patient outcomes. Each of our group members are enthusiastic about paying attention to detail, and together we're determined to improve patient care and safety.